Assalamu alaikum friends, here you are with Sayyida OMAMA SHAH, and today we're going to discuss the nerve signal transmission through adrenergic neurons and the adrenergic receptors. So let's start. So for the nerve transmission at adrenergic neuron, we will require a neurotransmitter, and that neurotransmitter will be norepinephrine because the neuron over here is adrenergic neuron. So first we are going to synthesize the norepinephrine. For that we will need an amino acid tyrosine. So tyrosine will transported by a co-transporter along with sodium into the presynaptic neuron, where it will be converted into dopa dihydroxyphenylalanine by an enzyme tyrosine hydroxylase. This dopa will be then converted into dopamine and by an enzyme called aromatic amino acid decarboxylase. Remember that dopa and dopamine can be converted into inactive metabolites by monoamine oxidase. So in order to prevent this conversion, we have to transport the dopamine into synaptic vesicle through a transporter called amine transporter systems, right? And this amine transporter can be inhibited by reserpine. So remember, this reserpine drug prevents the dopamine to enter into the synaptic vesicle by amine transporter. Now once the dopamine is entered into the synaptic vesicle, there it will be converted into norepinephrine by an enzyme dopamine beta hydroxylase. So until now we studied that the norepinephrine is being synthesized into the synaptic vesicle. Now once the norepinephrine is synthesized in the synaptic vesicle, it should be stored over there until there is an arrival of an action potential. So whenever there is an action potential arrival, what will happen? There will be an influx of calcium ions. So the calcium ion concentration inside the presynaptic neuron will enhance, and that enhancement or increase in the calcium ion concentration in the presynaptic neuron will fuse the vesicle with the membrane, and through exocytosis then the norepinephrine will be released into the synaptic space. Remember, this guanidine drug inhibits the release of norepinephrine by acting on the A2 receptor present on the presynaptic neuron. Now once the norepinephrine is being released into the synaptic space, it will now tend to bind to the receptors that is present in that particular tissue. Now binding of norepinephrine to the receptor will enhance the formation of second messengers. Now intracellular second messengers may be cyclic adenosine monophosphate and phosphatidylinositol cycle. These second messengers will then now produce a particular response. So once the norepinephrine perform its particular function, it has to be eliminated now from the synaptic space. For that we have three mechanisms. The norepinephrine can be removed from the synaptic space either by entering into the systemic circulation or by converting norepinephrine into inactive metabolites by catechol O methyltransferase, or it can be reuptaken back into the presynaptic neuron. Now here you can see the duloxetine, imipramine and cocaine. These three drugs are responsible to inhibit the neurotransmitter going back into the presynaptic neuron. This duloxetine is serotonin norepinephrine reuptake inhibitor, while imipramine is a tricyclic acid. Now, if a neurotransmitter is reuptaken back into the presynaptic neuron, what its fate will be? So, the recaptured norepinephrine can be either transported by amine transporter into the synaptic vesicle, where it has to be stored until the arrival of next action potential, or it can be either oxidized by monoamine oxidase. Monoamine oxidase will oxidize it. Monoamine oxidase will convert it into inactive metabolites, and it can be excreted through urine. So this was all the mechanism of neurotransmission through adrenergic neuron. Now we are going to move to our next topic, the adrenergic receptors. Now let's talk about the adrenergic receptors. So adrenergic receptors may be either alpha adrenoceptors or it may be either beta adrenoceptors. The classification is based on their affinity to different neurotransmitters. For example, if we talk about the alpha adrenoceptor, so it shows more affinity towards epinephrine and then norepinephrine, and lastly to the isoproterenol. Similarly, if we talk about the beta adrenoceptor, so it shows more affinity towards isoproterenol than to the epinephrine and shows weak response to the norepinephrine. First, talking about the classification of alpha adrenoceptors. So alpha adrenoceptors are classified into A1 and A2. First, talking about the alpha 1 receptor. So alpha 1 receptors are present almost everywhere in the body, but we're going to discuss only the presence, its presence in three major areas, and that are in the blood vessel, eye, and in the prostatic urethra. So in the blood vessel, the alpha 1 receptor causes blood vessel constriction. In the eye, it causes mydriasis, which is the dilation of the pupil, while in the prostatic urethra, it decreases the urine outflow by contracting the sphincter muscles. Now remember a condition, benign prostatic hyperplasia, BPH. This benign prostatic hyperplasia also decreases a urine outflow. So in benign prostatic hyperplasia, there is also a decrease in urine outflow, while alpha 1 receptor is also responsible to decrease urine outflow. Now how we are going to treat the BPH? We are going to treat the BPH by blocking the alpha 1 receptor. So if we block the alpha 1 receptor, the sphincter will relax and it will stimulate the urine outflow, and thus the urine outflow will be enhanced. So alpha 1 antagonist, we have a drug named tamsulosin, which is alpha 1 antagonist. By giving tamsulosin, we can treat benign prostatic hyperplasia. Now the second receptor is the alpha 2 receptor. This alpha 2 receptor may be present presynaptically and it may be present postsynaptically. So if it is present presynaptically, so it acts as a brake. How it acts as a brake? Remember that we studied that when the norepinephrine is released into the synaptic space, it then binds to the receptor present on the postsynaptic neuron. Some norepinephrine bind to this A2 receptor in order to inhibit the further release of norepinephrine. So this is all the mechanism. When a norepinephrine binds to the A2 receptor, it stops the release of norepinephrine from the presynaptic neuron. So this is only the function of A2 receptor. If A2 receptor is present presynaptically, it acts as a brake, but if it is present postsynaptically, then it acts in the same way as A1 receptor. But remember that the amount of A2 receptor present postsynaptically is much less as compared to A1 receptor. Now moving on towards our next receptor, which is the beta adrenoceptor. So the beta adrenoceptor may be beta 1, beta 2, or it may be either beta 3. First, eliminating beta 3 receptor and talking about the beta 3 receptor. Beta 3 receptor is only present in the adipose tissue, where they are responsible in lipolysis. Remember that the beta 3 along with beta 1 is responsible for lipolysis. Now just we finished this beta 3. Now moving on towards beta 1 and beta 2 receptor. So for that, you know that we have one heart and two lungs. So beta 1 will stimulate heart, while beta 2 will stimulate lungs. Beta 1 is also present in the juxtaglomerular cells of kidney. Now if a receptor or neurotransmitter binds with beta 1 receptor, it will stimulate heart. When a heart is stimulated, it will increase its contractility. Increase in contractility causes heart rate to increase, causing tachycardia. Tachycardia is known as when the heart rate of a person is increased. Now this beta 1 receptor is also responsible for renin excretion. It is present in the juxtaglomerular cells of kidney. So whenever it is stimulated, it will release renin, which will cause blood vessel to constrict and thus increasing the blood pressure. Now in beta 2 receptor, which is present in the lung, it is responsible for bronchodilation. Now I have a trick, you remember this. AB, write A, B, C, D, and in front of A you write 1 and in front of B you write 2. So A1 receptor is responsible for blood vessel constriction, while B2 receptor is responsible for blood vessel dilation. So this B2 is present almost in many areas of the body. In lungs, it will cause bronchodilation. So we know a condition known as asthma, in which there is bronchoconstriction of the bronchioles. The bronchioles constrict, so we have to relax the bronchioles. So what we are going to do, we will do B2 agonist. So if we do B2 selective agonist, it will act on the lungs and it will dilate the bronchioles and will use to cure or treat the asthma. So thanks for watching, all my dear friends. Allah Hafiz for now.